Right, hello, I'm Dr. Jeffrey Kile.
And I'm Dr. Alvaro Reymunde.
From PAK Pediatrics. And today we're here to talk about coronavirus or COVID-19 and give you guys some information. So, Dr. Reymunde, let's talk about where did this name come from? Where did COVID-19 come from?
Yeah, so COVID stands for coronavirus. And the coronavirus got its name actually from what the coronavirus looks like under a microscope. It kind of looks like a little crown or a corona. But really, COVID-19, the 19 comes because it was discovered in 2019. But what's really important to realize or remember is that coronavirus has been around for many, many years. We actually get it as the common cold pretty much every winter. Our kids get it, or us as adults, we get it as well. But it usually develops just a mild illness with some mild respiratory or upper respiratory symptoms. Not usually a whole big deal.
Correct. And specifically when we talk about the coronavirus, there are different types of coronaviruses. Right. It's not coronavirus 19 that circulates every year because this is a new one. But there are multiple viruses in that coronavirus family that we routinely see throughout the year. And in fact, there's been several outbreaks of other coronaviruses that have been similar to coronavirus 19 in a way. If you remember, there was the SARS outbreak in 2002, and then also the MERS outbreak, or Middle Eastern respiratory distress syndrome, that occurred in 2012. Yep. And they sort of had the same pattern where they actually started in bats and then mutated and went to other animals and then mutated again and then went to humans.
Finally, yeah. But what's important to realize, it did not come from eating bats.
Correct.
Which is one of the myths that are circulating out there.
Correct.
No, it initiated possibly in a bat, mutated into a different animal, and then mutated again to infect humans.
Correct. And the mortality rate to those viruses were much higher currently than coronavirus 19. I know SARS and MERS were at least over 10%, I think, for SARS, and almost 30% or more for MERS. But the important thing to remember about that is the amount of people that were infected were much less, on the tune of 8,000 to 10,000 people.
Speaking about that, why is it that COVID-19 is infecting so many more people when compared to SARS or MERS or some of these other ones? You mentioned that SARS or MERS had a higher mortality rate, but COVID-19 seems to be killing more people. How does that make any sense?
Well, it's because this virus, I believe, is very novel and we've never seen it before. Our immune systems have just never seen it, and the spread of the virus has just been much more rapid than the other viruses of SARS and MERS. They are much easier to contain.
And what we think is possibly one of the reasons for that is that COVID-19 actually causes a very mild disease in 80% of the people that it infects. So basically, anybody could be walking around and potentially have COVID-19 and not really know it. And then they're spreading it more often. And I think this is where the problem comes from. I think many people are getting infected because they don't even know they have it and they just keep spreading that illness.
Right. And actually the infectivity of COVID-19 is pretty strong. So every year we see influenza going around. And if you have influenza and you're in a room of people and you expose them to influenza, the amount of people that probably get infected is like 1 to 1. So if one person has influenza, one other person that does not have the disease can get it. Where in COVID-19, it's a little bit more aggressive. So if you have one person that has COVID, whether it's asymptomatic disease, meaning they don't have symptoms, or whether it's when they have symptoms, they can actually infect up to 3 people at a time. So when you think about it, if one person with COVID-19 infects 3 people, then those 3 people can infect 3 people more. So it's really a big multiplier as it goes on. So it could spread very quickly because of that.
That sounds pretty scary.
It does. It does.
So I think this is why COVID-19 is such a big deal. And so many people are getting infected. Mortality rate, I think, and this changes day by day, really, but it seems like it's somewhere between 1.5 and 3.4% of people, which is a small percentage compared to 100%, obviously. But since so many people are getting infected, that small percentage still accounts for a high number of people. And I think this is what's going on.
Correct. And that's why we have to be careful when we're saying that, well, there's other viruses that have a higher mortality rate. But if the amount of people that have them is a lot less, then the amount of deaths are actually less. So if you're infecting millions of people, like the COVID virus potentially can, the amount of even 3% of a million is a lot of people.
And speaking of which groups of people, or who is at higher risk of being in that 1 to 3.4%?
So that sort of can change too. But what we know currently is that people that are 60 years of age and older are definitely at higher risk for having severe complications and death from the COVID virus. But then also there's people that have chronic medical conditions that we really have to worry about, such as those patients that have lung disease, like asthma, diabetes, immunocompromised patients, like those with cancer, and those with cardiovascular disease, like hypertension and heart failure and things like that.
And that makes sense. If you have chronic conditions, you tend to need to be more careful about getting any virus in particular.